Greetings. My name is Franck Rahaghi. I am a pulmonary physician, the chairman of the Pulmonary Critical Care Department at Cleveland Clinic in Weston, Florida, and the director of the Pulmonary Hypertension Clinic. And today we have the pleasure of talking to you about dosing and adverse effect management as a team.
Hi, I am Starlet Harrimon. I am an RN. I serve as the Advanced Lung Disease Coordinator at Cleveland Clinic, Florida. And today we're going to be talking about my role in starting patients on Orenitram therapy.
So we got involved in the Freedom trials early on, and including the registration trials. And since then, we've learned that we can start the patient at lower doses, maybe titrate them up slower, and go to TID dosing instead of BID dosing for better adverse effect management. We also noticed in Freedom EV and even earlier that our patients that achieve higher doses seem to have better outcomes. And Freedom EV actually did show that patients who get to 3 milligram TID or greater have a walk improvement of 25 meters, which actually is a clinically impactful change.
I definitely think that managing their expectations is the biggest part of my job up front. These expectations include how long it's going to take to actually get started on the medication, what their insurance is going to cover. I always try to make them understand that this is a journey. This is not a sprint. We're not getting somewhere super fast. And I want them to understand how they're going to feel along the way before they actually do start to feel better so that we're able to keep them on therapy.
The way we try to address adverse events is by addressing it head on as basically one of the biggest responsibilities. And I think one of the most important things we do is right off the bat, we tend to emphasize the top 3 adverse effects that are most likely to occur, which in the case of Orenitram would be diarrhea, headache, and nausea. And we try at the visit to prepare them for the fact that these things may happen and are likely to happen, in fact, and they will leave with a prescription in their hand that would help them manage these top 3 adverse effects.
So I normally come in and speak to them after Dr. Rahaghi has, so I do a lot of reinforcement of what he just talked about. We talk about what the expected side effects are. Again, how do we manage them? We'll talk about some non-pharmaceutical ways to manage the side effects. So we let them know there's things that we can do if they're having trouble. And I want to make sure that we have an open line of communication so they reach out and they know that we're there to help. And we want them to let us know so that they stay on medication. We don't want them to feel like they're suffering alone.
Well, obviously, we have a really good relationship with our specialty pharmacy providers. And, it does take a little bit of personal interaction with them for them to know what your needs are and how you manage your patients, and to sort of allow communication to occur freely. Also, when it comes to adverse effect management, at the end of the Orenitram enrollment form, there's an area that says optional and basically allows you to share with the specialty pharmacy some of the strategies that you agree to in terms of adverse effect management, that then they can help you institute that with the patients. As we mentioned earlier, this is all sort of built upon a direct relationship with the patient and clear communication.
Orenitram treprostinil extended release tablets. Indication: Orenitram is a prostacyclin mimetic indicated for treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to delay disease progression and to improve exercise capacity. The studies that established effectiveness included predominantly patients with WHO functional class 2 through 3 symptoms and etiologies of idiopathic or heritable PAH, 66%, or PAH associated with connective tissue disease, 26%. Important safety information for Orenitram. Contraindications: avoid use of Orenitram in patients with severe hepatic impairment, child Pugh Class C, due to increases in systemic exposure. Warnings and precautions: Abrupt discontinuation or sudden large reductions in dosage of Orenitram may result in worsening of PAH symptoms. The Orenitram tablet shell does not dissolve. In patients with diverticulosis, Orenitram tablets can lodge in a diverticulum. Adverse reactions. In the 12-week placebo-controlled monotherapy study and an event-driven placebo-controlled combination therapy study, adverse reactions that occurred at rates at least 5% higher on Orenitram than on placebo included headache, diarrhea, nausea, vomiting, flushing, pain in jaw, pain in extremity, hypokalemia, abdominal discomfort, and upper abdominal pain. Drug interactions. Co-administration of Orenitram and the CYP2C8 enzyme inhibitor gemfibrozil increases exposure to treprostinil. Therefore, Orenitram dosage reduction may be necessary in these patients. Specific populations. Animal reproductive studies with Orenitram have shown an adverse effect on the fetus. There are no adequate and well-controlled studies with Orenitram in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Safety and effectiveness of Orenitram in pediatric patients have not been established. Use of Orenitram in patients aged 65 years and over demonstrated slightly higher absolute and relative adverse event rates compared to younger patients. Caution should be used when selecting a dose for geriatric patients. There is a marked increase in the systemic exposure to treprostinil in hepatically impaired patients. Please see full prescribing information and patient information at www.orenitram.com or call 1-877-UNITHER, 1-877-864-8437.